Never mix these supplements. 7 combinations that can harm your health, and how to take them the right way. Do you usually take more than one supplement a day? Have you ever mixed different vitamins thinking that this could speed up the results? Could combining supplements actually be harming your health? Most people believe that supplements are always beneficial and that the more we take, the better it will be for our body. But what many don't know is that some seemingly harmless combinations can cancel out their effects or even provoke dangerous reactions. Did you know that more than 23,000 people in the United States go to the hospital every year for improper use of vitamins and supplements? And that about 9% of these cases result in hospitalizations? This is because the interaction between certain nutrients can be toxic, even when each of them, in isolation, brings benefits. Do you really know what you're putting into your body? In this video, we'll reveal the most dangerous combinations, show you how to take your supplements correctly, and explain which combinations are the most effective and safe. Let's get started. You may be poisoning yourself without knowing it. The truth about combined supplements. Have you ever stopped to think that a simple, healthy habit can turn into a silent risk to your health? The consumption of supplements and vitamins has skyrocketed in recent years, becoming part of the routine of millions of people. In the United States alone, more than 80% of the population regularly uses some type of supplement. The intention can even be good, to strengthen the body, compensate for nutritional deficiencies, or prevent diseases. But often, the way these products are used is what puts everything at risk. Combining different vitamins and minerals without proper knowledge can cause the body to absorb less than it should, or even worse, to accumulate substances at toxic levels. It's like trying to help the body and end up sabotaging it without realizing it. And, despite labels and advertisements suggesting that everything is natural and safe, science has already shown that the inappropriate use of these compounds can cause serious adverse reactions, such as bleeding, metabolic disorders, and even heart problems. Therefore, it is essential to understand that not every combination is beneficial. Some substances interact with each other, canceling out their effects or increasing risks. And yes, even natural products, such as green tea, can hinder or even aggravate a clinical condition. Before you go out mixing colored capsules with the hope of improving your health, it is necessary to know what can and cannot be associated. Your body is a complex machine, and the balance between nutrients is essential. In the next topics, you will find out which combinations are dangerous, why they work poorly, and how to avoid these mistakes. 1. The hidden trap between vitamin C and B12. Have you ever heard that vitamin C is excellent for strengthening the immune system, and that vitamin B12 is essential for the functioning of the nervous system? Both are true, but what almost no one comments on is that taking these two vitamins at the same time can be a big mistake. According to scientific studies, vitamin C in high doses can interfere with the absorption of vitamin B12 within the digestive tract. This is because vitamin C, being highly acidic, can destroy some of the vitamin B12 before the body can even absorb it. The result? A silent B12 deficiency, which can lead to symptoms such as chronic fatigue, tingling in the limbs, difficulty concentrating, and even more serious neurological problems in the long term. Most worryingly, many people believe they're strengthening their bodies by combining these two vitamins, when in fact, they're creating a dangerous nutritional imbalance. To avoid this problem, the expert's recommendation is simple but effective. Wait at least 2 hours between taking vitamin C and vitamin B12. This way, you ensure that your body gets the most out of each one without running the risk of losing its benefits or developing a deficiency over time. Small adjustments make big differences in your health. 2. Copper and zinc. The silent dispute that harms your health. Copper and zinc are two essential minerals for the proper functioning of the body. Copper participates in processes such as energy production, strengthening the immune system, and collagen formation. Zinc, on the other hand, is famous for helping with healing, fighting infections, and hormonal balance. But when these two minerals are ingested together, they come into direct conflict. This is because zinc, when consumed in high doses or frequently, can inhibit the absorption of copper in the body. That is, even if you are taking copper in the correct dose, excess zinc can prevent it from being absorbed properly. The result can be a copper deficiency, which manifests itself with symptoms such as weakness, extreme tiredness, sensitivity to cold, anemia, and even bone changes. And the most serious, these symptoms are often confused with other health problems, which makes it difficult to make a correct diagnosis. If your doctor has recommended the use of both supplements, the ideal is to take them at different times, with at least 2 hours between one and the other. This way, you prevent one from getting in the way of the other's effect and allow your body to absorb as much of each nutrient as possible. In supplementation, order and time make all the difference. 3. An explosive duet. Ginkgo biloba and omega-3s can be life-threatening. Separately, Ginkgo biloba and omega-3s are supplements with widely recognized benefits. Ginkgo is known to improve cerebral circulation and promote memory and concentration. Omega-3s, meanwhile, are famous for their protective effects on the heart, vision, and brain. But together, they can pose a risk that many people overlook: significantly increased blood flow. Both supplements have anticoagulant properties. This means that they reduce the blood's ability to form clots, which can be beneficial in some situations but extremely dangerous in others. When combined, these effects add up and can result in spontaneous bleeding, frequent bruising, and, in more severe cases, internal bleeding. For people who already take anticoagulant medications or who are going to undergo surgery, this mixture can be fatal. Imagine a simple cut that takes hours to stop, or a small wound that turns into something serious. This is why experts recommend absolute caution when using these two supplements at the same time. If it is still necessary to take them, it should be done with close medical follow-up and constant monitoring. What is good separately does not always remain good when combined. Your health should not be based on assumptions, but on well-informed decisions. 4. When magnesium and calcium are no longer allies and become villains. Magnesium and calcium are two fundamental minerals for the functioning of the body. Calcium is essential for strong bones, healthy teeth, and muscle contraction. Magnesium, on the other hand, participates in more than 300 chemical reactions in the body, including the regulation of muscle and nerve function, blood glucose levels, and blood pressure. In theory, they should work in harmony, and they often do. But this relationship is only beneficial when the proportion between them is balanced. The problem begins when calcium is ingested in excess of magnesium. In this condition, calcium starts to compete for absorption, drastically reducing the amount of magnesium available to the body. Over time, this can lead to symptoms such as cramps, irritability, muscle weakness, irregular heartbeat, and even an increased risk of cardiovascular disease. Studies show that the ideal ratio of calcium to magnesium should be less than 2:1. If this scale is disrespected, the damage to health can be serious. Another important point is that, although they are often combined in supplements, the ideal is to take them at different times of the day, at least 2 hours apart. This helps the body absorb each mineral more efficiently, avoiding conflicts that compromise its effects. Balance is key. Even the best allies can become villains when they are not used wisely. 5. Green tea. Iron, the combination that sabotages your energy. Green tea is one of the most popular natural drinks in the world. Rich in antioxidants, it is known to help control blood pressure, improve metabolism, and even contribute to weight loss. On the other hand, iron is an essential mineral for the production of hemoglobin, which is responsible for carrying oxygen in the blood. When the body lacks iron, symptoms such as constant tiredness, shortness of breath, dizziness, and hair loss appear. But here's the problem: The consumption of green tea can hinder, and a lot, the absorption of iron by the body. That's because green tea contains compounds called tannins, which bind to non-heme iron, the type present in plant foods and supplements, making it harder to absorb in the gut. Even if you're taking iron supplementation on your doctor's recommendation, continuing to drink green tea daily may cause the treatment to not work as it should. And the worst, without realizing it, you continue to have symptoms of iron deficiency, believing that you are doing everything right. To avoid this blockage, experts recommend that you don't drink green tea for at least 2 hours before or after ingesting iron. In addition, reducing daily consumption of the beverage during periods of intense supplementation can be a smart measure. Sometimes, what feels healthy may be sapping your energy from within. 6. Vitamin D, E, and K. Why taking them together can be a serious mistake. Vitamins D, E, and K belong to the fat-soluble group, which means they need fat to be absorbed by the body. Each of them performs vital functions. Vitamin D regulates calcium metabolism and strengthens bones. Vitamin E is a powerful antioxidant that protects cells from damage. And vitamin K is essential for blood clotting and cardiovascular health. Individually, they are extremely beneficial. But when taken together and without proper control, they can get in each other's way. Studies indicate that high doses of vitamin D and vitamin E can interfere with the absorption of vitamin K. This happens because these vitamins share transport mechanisms in the body, competing with each other to be metabolized. If vitamin K is not properly absorbed, you may have difficulty clotting your blood, as well as reduce the beneficial effects it offers for bone and heart health. The recommendation is clear. Even if these vitamins are present in a multivitamin, avoid taking them all at once. The ideal is to separate them throughout the day, with at least 2 hours between each one. And always consume them along with foods rich in healthy fats, such as avocados, olive oil, or nuts. It's not about avoiding these vitamins, but rather learning how to use them in the right way. Your body will thank you, and so will your health. 7. Vitamin C and iron. The truth about a duo that doesn't always work for a long time. It was common to hear that vitamin C helps the body absorb iron better, and that statement is true, in part. Vitamin C actually increases the absorption of non-heme iron, which is present in plant foods and many supplements. But as with everything in life, excess can be harmful. When vitamin C is ingested in large quantities along with iron, it can increase the absorption of this mineral so much that it ends up raising iron levels in the body beyond what is necessary. This buildup, known as iron overload, can be extremely dangerous. It is associated with damage to organs such as the liver and heart, in addition to causing oxidative stress, which accelerates cellular aging. And there's more. People with genetic conditions, such as hemochromatosis, for example, are even more at risk when they combine iron and vitamin C without medical advice. This is because their bodies already absorb excess iron naturally. If you need to supplement iron, the ideal is to do it under professional supervision and with well-controlled dosages. And if you are going to include vitamin C in this process, make sure that the amount is within the recommended amount. It is not a matter of eliminating the combination, but of using it consciously. Remember, even the best intentions can lead to serious mistakes when it comes to supplementation. Combinations that boost your health when done right. Not all combinations of vitamins and supplements are dangerous. In fact, some interactions can enhance the effects of each nutrient, making the use even more effective. The secret lies in knowing which substances work best together and how to administer them correctly. There are nutritional synergies that have been proven by scientific studies and that show real benefits for bone, cardiovascular, immunological, and even cognitive health. But even these positive combinations require attention to dosage, time, and form of intake. For example, many of these vitamins need to be consumed with a meal with healthy fat to be well absorbed. Others should be taken separately, even if they are compatible, to avoid competition during the digestion process. These are combinations recommended by nutritionists and health professionals, which can help you get the most out of supplements without putting your health at risk. Be aware, because understanding these interactions can be the difference between a supplement that works and one that simply passes through your body without having an effect. Ready to transform your way of supplementing? 1. Vitamin D and K2, the duo that strengthens your bones like no other. Vitamin D and vitamin K2 form one of the most effective partnerships when it comes to bone health. Vitamin D is responsible for increasing the absorption of calcium in the intestine, ensuring that this essential mineral reaches the bloodstream. However, calcium needs to be directed to the right place, and that's where vitamin K2 comes in. It acts as a kind of guide, leading calcium to the bones and teeth, where it must be deposited. Without the presence of vitamin K2, calcium can end up accumulating in the arteries and soft tissues, increasing the risk of unwanted calcifications, hypertension, and cardiovascular disease. Studies show that this combination not only improves bone mineral density, but also contributes to the prevention of osteoporosis and fractures in the elderly. In addition, joint vitamin D and K2 supplementation has been shown to reduce levels of deactivated osteocalcin, a marker that indicates poor calcium utilization in the body. The most interesting thing is that, at the same time as strengthening bones and teeth, these vitamins also protect the cardiovascular system. To get the most out of this combination, it's recommended to take both with a meal that contains healthy fats, such as olive oil, avocado, or nuts. And always respect the recommended daily dose, avoiding excess that can overload the body. When used well, vitamin D and K2 are an unbeatable duo. 2. Vitamin D and magnesium. Without one, the other doesn't work. Many people take vitamin D to strengthen bones, improve immunity, and fight fatigue. But what few know is that without enough magnesium in the body, vitamin D may simply not work as it should. Magnesium is an essential mineral for the activation of vitamin D in the body. It participates in the conversion of vitamin D into its active form, which is the one that actually acts in the body, regulating calcium metabolism and directly influencing bone and muscle health. Without magnesium, even if you take high doses of vitamin D, your body won't be able to take full advantage of it. Studies show that magnesium deficiency is directly related to persistently low levels of vitamin D in the blood, even with supplementation. In addition, the absence of magnesium can increase the risk of side effects of vitamin D use, such as muscle pain, insomnia, and irritability. This combination is also important for the proper functioning of the heart, brain, and immune system. So, if you're taking vitamin D, make sure you're getting enough magnesium through proper diet or supplementation. The ideal is to seek medical or nutritional advice to balance the doses correctly and ensure that both are acting in synergy. Remember, one without the other is like a key without a lock, and your body needs both to function fully and healthily. 3. Vitamins A, D, E, and K. The secret is in the right fat. Vitamins A, D, E, and K have something important. In common, they are all fat-soluble. This means that they need fat to be absorbed by the body efficiently. Without the presence of lipids in the meal, these vitamins pass through your digestive system practically without being used. That is, even if you are taking a supplement with all these vitamins, if there is no fat in the stomach at the time of ingestion, the effects will be minimal or even zero. These 4 vitamins are essential for vital functions such as vision, bone strengthening, cell protection, and blood clotting. When taken correctly, they can offer a real health boost. But for this, the secret lies in an often ignored detail: the food that accompanies supplementation. Studies show that consuming these vitamins, along with foods rich in good fats, such as avocados, olive oil, nuts, eggs, and fatty fish, enhances their absorption. On the other hand, taking them on an empty stomach or only with liquids drastically compromises their effects. In addition, it is worth remembering that even though they are important, these vitamins can accumulate in the body if they are ingested in excess, causing toxicity. Therefore, respecting the daily dose and having professional guidance is essential. The combination of these 4 vitamins can be powerful as long as you know how to activate this potential at the right time. 4. Vitamin E and omega-3, a powerful pair for your heart. When it comes to cardiovascular health, few combinations are as promising as vitamin E with omega-3 fatty acids. Both nutrients in isolation already offer significant benefits. Vitamin E acts as a powerful antioxidant, protecting cells from oxidative stress and reducing inflammatory processes. Omega-3, in turn, is a good fat that helps reduce triglyceride levels, control blood pressure, and prevent plaque formation in the arteries. But it is when these 2 allies are combined that the results become even more expressive. Studies of patients suffering from heart disease have shown that supplementation of vitamin E and omega-3s together can reduce insulin resistance, decrease systemic inflammation, and improve endothelial function, that is, the health of blood vessel walls. This synergy is especially useful in the prevention of diseases such as heart attack, stroke, and hypertension. In addition, this combination can also benefit the immune system and even improve cognitive performance. But beware, as omega-3 also has a mild anticoagulant effect, it is essential to consult a health professional, especially if you already use blood-thinning medications or if you have a history of bleeding. To better absorb both nutrients, it is recommended to eat them during a main meal, rich in healthy fats. Used responsibly, vitamin E and omega-3s form a true protective shield for the heart. 5 mistakes almost everyone makes when mixing supplements. Taking supplements seems simple, just follow the label and you're good to go, right? Many common mistakes go unnoticed by those who try to improve their health with colored capsules and effervescent tablets. And these mistakes, despite seeming harmless, can compromise your health and your money. The first mistake is to think that because they are natural, supplements do not cause side effects. This is not true. Too many vitamins and minerals can lead to toxicity and even dangerous drug interactions. The second mistake is to take everything at the same time, without respecting schedules or the ideal way of ingestion. As we have seen, some substances need fat, others on an empty stomach, and many simply should not be combined. The third mistake is blindly relying on generic multivitamins. These products do not always have the ideal dosage and often mix nutrients that compete with each other, reducing absorption. The fourth mistake is not informing the doctor about the use of supplements. This omission can cause interactions with prescription medications or mask important symptoms. And the fifth mistake, perhaps the most common, is to believe that more is always better. Supplementation should be personalized, based on professional exams and guidance. The human body is a complex machine that needs balance, not exaggeration. Avoiding these mistakes is the first step to making a really effective and safe supplementation. Multivitamins. The hidden risk behind practicality. Multivitamins seem like the perfect solution, a single capsule that brings together several vitamins and minerals essential for health. Practical, fast, and convenient. But doesn't this facility hide dangerous pitfalls? The truth is that many multivitamins contain combinations of nutrients that, when ingested at the same time, compete with each other for absorption. This means that even though you're ingesting a long list of nutrients, your body may only be absorbing a portion of them. For example, minerals such as calcium, iron, zinc, and magnesium compete for the same absorption channels in the intestine. When they are together in the same supplement, one can inhibit the other, reducing the effectiveness of all. In addition, many of these formulas have standardized doses that do not consider the individual needs of each person. While you may need more vitamin D, someone else may be deficient in B12, but the multivitamin offers the same amount for everyone. Another important risk is the accumulation of fat-soluble vitamins such as A, D, E, and K. They are stored in the body and, when ingested in excess, can cause toxicity with serious symptoms such as joint pain, nausea, irritability, and even liver damage. Finally, many of these products contain unnecessary colors, artificial sweeteners, and additives. Therefore, although they seem advantageous, multivitamins should be used with discretion and preferably under medical or nutritional guidance. Not everything practical is safe, and your health deserves individualized attention. Excess. Vitamins. Symptoms. You shouldn't ignore. When we talk about vitamins, it's common to think that the more, the better. But this is far from the truth. Excess vitamins, especially fat-soluble vitamins, such as A, D, E, and K, can lead to a condition called hypervitaminosis, which is the toxic accumulation of these substances in the body. And the symptoms of this imbalance often go unnoticed or are confused with other health problems. One of the first signs that something is not going well is constant fatigue, even after a good night's sleep. Frequent nausea, headaches, irritability, and gastrointestinal upset can also be indications that your body is getting more vitamins than it needs. In the case of vitamin A, for example, excess can cause hair loss, blurred vision, and bone pain. The accumulation of vitamin D can lead to an increase in calcium in the blood, generating symptoms such as excessive thirst, mental confusion, and even cardiac arrhythmias. Vitamin B6, when taken in large amounts for long periods, can cause neurological damage, leading to tingling and loss of sensation in the extremities. Another critical point is the interaction of vitamins with medications. Vitamin K, for example, can reduce the effect of anticoagulants, compromising important treatments. Therefore, it is essential to be aware of any unusual symptoms during supplementation. At the slightest sign of discomfort, seek medical advice and review your doses. More important than supplementing is understanding what your body really needs. The safest and most effective way to take supplements. Taking supplements should not be a matter of fad or automatic routine. It is a decision that requires responsibility, information, and above all, personalization. The first step to safely supplementing is knowing exactly what your body needs. And this is only possible through laboratory tests and an evaluation by a health professional. Do not go out drinking what works for the other. Each organism has its own needs. Once you've identified your specific shortcomings or demands, the next point is to understand when and how to take each supplement. Some work better on an empty stomach, such as certain B vitamins and vitamin C. Others should be consumed with fatty foods, such as fat-soluble vitamins A, D, E, and K. Separating supplements is also key. Avoid taking it all at once, especially when it comes to minerals like iron, calcium, magnesium, and zinc, which compete for absorption. An interval of at least 2 hours between them already makes a big difference. Another important precaution is to always inform your doctor about all the supplements you are taking, especially if you use continuous medications. There are dangerous interactions that can compromise treatments and generate serious side effects. And finally, never exceed the recommended dose. Supplementation is not a race to see quick results, but a process of continuous health care. The key is balance, knowledge, and professional monitoring. Taking care of your health goes far beyond taking supplements or following fads. It's about making conscious choices based on quality information and respect for your own body. In this video, you've discovered that not every combination is safe, that too much can also be dangerous, and that even the most common supplements require special attention. But he also learned that, with correct and guided use, these substances can be powerful allies for his well-being. The secret is in balance, self-knowledge, and above all, in the search for professional guidance. Don't wait for symptoms to appear to start taking care of yourself. Take the next step responsibly. Talk to your doctor, get your exams done, and understand what your body really needs. Because when you understand your body, you make smarter decisions. And these decisions build a healthier, stronger, and happier future. Your health deserves this care. Get started today.